Entry information. You're dispatched to an 18-year-old male patient who's complaining of chest pain.
Okay. BSI is my scene say.
You're seen safe.
Okay. So my nature of illness is I have an 18-year-old patient complaining of chest pain. Is this my only patient?
This is your only patient.
Okay. So right off the bat, I'm going to consider AL as backup.
ALS back up on its way.
Okay. So now, since I see my patient, he is seated. I'm not going to consider C-spine at the moment because I don't think I will need it. So now my general field impression is that I have an 18-year-old patient complaining of chest pain. So now I'm going to go and introduce myself. Hi, I'm Eddie. I'm your EMT. What is your name?
My name's Caesar.
Okay, Caesar. What seems to be the problem today?
I have chest pain.
You have chest pain? Okay. So my patient's chief complaint is chest pain. So he is conscious and alert because he's able to communicate with me and he's able to tell me what's wrong with him. So his airway, there's nothing blocking his airway. So what I'm going to do now is I'm going to check his breathing sound with this stethoscope. All right. Breathe in for me. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. So how are my patient's lung sounds?
Your patient's lung sounds clear and bilateral.
Okay, so since his patient's lung sounds are clear and bilateral, but he is having some chest pain, so I'm going to put him on high flow 2 oxygen, non-breathable mask, 15 liters per minute. So now what I'm going to do is I'm going to go and check my patient's pulse. Okay. What are my patient's pulse?
Your patient's pulse is 88 beats per minute.
88 beats per minute. Okay, so now I'm going to check his respiratory rate. So what's my patient's respiratory rate?
Patient respiratory rate is 18 breaths per minute.
18 breaths per minute. Okay. So now, is there any signs of major bleeding?
No major signs of bleeding on the patient.
Okay, so now I'm going to assess my patient's skin. So my patient's skin is cool, clammy, a little sweaty. Since he's cool and clammy, I think my patient may be suffering from shock. So I'm going to treat for shock. I'm going to keep him warm, and I'm going to make him a high priority patient at the moment. So now what I'm going to do is I'm going to get a medical history or assessment of my patient. So I'm going to go based on my OPQRST. So when did this pain occur?
During football practice.
During football practice? Okay. And does anything make it better or worse?
It gets worse when I run and tackle.
It gets worse when you run and tackle? Okay. Can you describe your pain?
It's a very sharp pain.
Very sharp pain? Right here in the middle?
Yeah.
Towards the middle of the chest? Okay. And does your pain, does the pain move?
Yeah, it moves from here to the left side.
Okay, so, okay. From here to here?
Yeah.
Okay, and on a scale to 0 to 10, what is your pain level?
8.5.
8.5. Okay, and what time did this happen?
An hour ago.
An hour ago?
Yeah.
Okay, it happened about an hour ago. Okay, so are you allergic to any medications?
No.
Allergic to no, okay. So are you taking any medications at the moment?
Starts with an N.
Nitroglycerin?
Yeah.
Okay, you're taking nitroglycerin. Okay. Have you had any past medical problems as far as seizures, diabetes, asthma attacks?
No.
No? Okay. What was the last thing you ate?
Ham and cheese sandwich.
Ham and cheese sandwich? Okay. And once again, what were the events leading up to this chest pain discomfort?
I was going to football practice and I just started running and it just started hurting immediately.
Started hurting immediately? Okay. So now what I'm going to do is I'm going to do my secondary assessment for my patient. So since his chief complaint is with his chest, I think this is a cardiovascular type of discomfort. So what I'm going to do is I'm going to check his lung sounds again. So you can you breathe in for me? Okay. Breathe in for me. Okay. You breathe in for me again. Okay. And breathe in for me again. Okay. So how are my patient's lung sounds?
Your patient lung sounds clear and bilateral.
Okay, so now what I'm gonna do is I'm gonna palpate the chest. So do you feel any pressure, any pain on this side when I feel it?
Yeah.
A little bit of
Yeah,
pain?
a little bit.
Okay. What about here?
Yeah.
Does it hurt more or
Yeah,
less?
it hurts more.
More, so if I press on it, does it hurt more?
Yeah.
Okay. So now what I'm gonna do is I'm gonna note that, saying that he has it hurts if I pressure if I touch his chest. So now what I'm gonna do is I'm gonna take my patient's blood pressure. Okay. So what's my patient's blood pressure?
Your patient blood pressure is 120/80.
120/80. Okay. I'm gonna note that. So now I'm gonna check my patient's pulse. Again. So what's my patient's pulse?
Patient pulse is 88 beats per minute.
88 beats per minute. Okay. So now I'm gonna check his respiratory again. Okay. So what's his respiratory rate?
Patient respiratory rate is 20 breaths per minute.
20 breaths per minute. Okay. So now my field impression of my patient is that I believe he is suffering from chest pain. I believe he has angina from all the symptoms that he told me. So what I'm gonna do is since he is taking some medication for it, he's taking nitroglycerin, and I see that he has some nitroglycerin here and it's not expired. I'm gonna give him, is it okay if I give him 1 dose of nitroglycerin?
Okay to give 1 dose of nitroglycerin.
Okay, open your mouth. Okay, so I gave my patient 1 dose of nitroglycerin to help out with the chest pain, which I believe he's suffering from angina. So my interventions of what I've done to my patient is I put him on high flow 2 oxygen, I treated him for shock, I checked his blood pressure, his pulse, his respiration, and I gave him 1 dose of nitroglycerin. So now what I'm gonna do is I'm gonna wait until ALS backups arrive so I can give a report. So once the ALS backup arrives, I'm gonna give a report. So I have a 18-year-old male patient complaining of chest pain. I put him on high flow 2 oxygen. His blood pressure is 120/80, pulse 88, respiration is 18. I believe he may be suffering from shock. He has no allergies to medication, but he is currently taking nitroglycerin. He's having chest pain on this side, going to the left side. If you palpate, he feels more pressure. Like I said, he is on high flow 2 oxygen, and he is a priority patient. He is being ready to transport. And I am done.